Welcome to the Journal of Marital and Family Therapy's Decade in Review video series, hosted by the American Association for Marriage and Family Therapy. The special Decade in Review issue is the fourth of its kind over the years and assesses the efficacy and effectiveness of couple and family therapy by reviewing rigorous studies published over the 10-year period from 2010 to 2019. The findings from the special issue show the tremendous progress and achievements made to date, inspiring our continued commitment to making marriage and family therapy and interventions widely available. Throughout this series, we're talking directly with the authors who made this special issue a reality, and today's focus is on intimate partner violence and child maltreatment. I'm joined today by Drs. Sandra Stith and Glade Topham. I first say thank you to you both for being here today.
Glad to be here.
Terrific. So the first thing I'd like to do is to set the stage a little bit. Can you talk to me a little bit about the prevalence of intimate partner violence or child maltreatment and what that means for marriage and family therapists? If we could sort of define those terms, IPV and child maltreatment both, that would be great. Why don't we start with you, Sandra?
That's really important to start to thinking about what do we mean by intimate partner violence. What we know from our research is that there's situational couple violence, and there's more of a intimate terrorism type of violence. So many people who say you don't work with couples where there's violence, they're really talking about intimate terrorism. Those are the cases where oftentimes it's male to female, but not always. But it's oftentimes somebody's afraid that they may be killed. Like if I speak out and I say the truth in this therapy session, I could be killed. So those are people that are going to be more likely to be court ordered, more likely to be in offender treatment. But as family therapists, we're working with couples that are situationally violent. We know that the 40 to 60% of couples who come in for just regular therapy, they're just wanting help with their relationship. There's some kind of physical, psychological, sexual, financial abuse that's going on. So any of those kinds of abuse is in that definition of intimate partner violence. But we're really looking more at the situational couple violence that's not as likely to lead to death. So that's sort of a description of both the definition, but also the frequency of intimate partner violence. Thank you.
Thank you, Sandra. Over to you, Glade.
Yeah, child maltreatment is sort of the broad descriptor we often use for child abuse and neglect, but it includes a lot of things. It includes physical and sexual abuse, emotional abuse. It includes neglect, where a parent or caregiver isn't available, isn't responsive to a child's emotional, medical, physical, emotional, other needs. And unfortunately, the numbers are really quite high. In 2020, there were just under 4 million child maltreatment referral reports made that involved over 7 million children who are potentially affected by those experiences with child maltreatment from their caregivers. As family therapists, we see the effects of this often right after abuse has occurred. When a report has been made and a family's been referred to come to us, we'll work with the family, we'll work with the parents. But also we see the effects of child maltreatment throughout the work we use, throughout the work we provide, throughout the lifespan of our clients as they continue to heal from and try and cope with and deal with the effects of often early abuse or neglect from their caregivers.
Thanks so much. And Glade, that's a good segue to talk a little bit about how can the impacts of IPV or child maltreatment extend throughout one's life?
Yeah. So there are particularly strong implications for children. The source of children's support and care and love is their parents. It's their caregiver. When they become frightened, when they become sick, scared, sad, they go to their parents and they receive protection and nurturance and love and care. And when the source of the threat is supposedly the source of the support, children are presented with this unresolvable dilemma. I'm scared of my caregiver, and that's who I need to go to for care. And it's very emotionally harmful to children as in their tender years as they're growing up, and has pretty significant implications for their growth and development, and affects their ability to cope with and manage emotion and stress, which makes a lot of sense given that their source of help with that is their caregiver. They don't develop the capacities to cope with stress and manage emotion like they might. And often it shows up in increased risks for internalizing and externalizing behaviors throughout childhood and into adolescence, and really interferes with and impedes the development of healthy and long-term close relationships.
Thanks so much, Glade. The review focused on interventions targeting couple and parent-child relationships. Sandra, why was this approach important?
Well, this is extremely important for us. As we look at situational couple violence, most of those couples that are coming, 50–60% of couples who come in, there is some kind of aggression that's going on. So for therapists to be trained, to be working with couples and addressing violence is really important. So only looking at individual treatment just misses so many people who come in for therapy, for help. So that's why it's really important to look at the couple.
Glade, same question over to you. Why is this approach important?
Yeah, and I suppose the answer is a bit obvious, but child abuse and neglect, child maltreatment happens in the context of the parent-child relationship. And a treatment focus needs to attend to not just the child's experience of the abuse, but needs to focus on the parent-child relationship that potentially might continue to be a source of stress and even harm to a child.
Thanks very much. The review includes many studies that focused on prevention rather than families who have already been exposed to IPV or child maltreatment. Sandra, why was this the case?
That's a really interesting question, because we found those prevention studies only in the couple, in the intimate partner violence. That wasn't true in the child maltreatment. But we did not search for anything in prevention, but we kept finding these studies that were really addressing the issue of intimate partner violence through prevention programming. And in our research, we looked at the studies looked at pre-test and post-test, the violence at the beginning and the violence at the end. So they really weren't exactly prevention, but the goal of the program is prevention of it going from like situational to becoming intimate terrorism.
Thanks very much. Let's talk a little bit about some of the treatments that we observed. So what treatments did the review show were well established, Glade?
Yeah, so we grouped the treatment programs by type of program. And one type of program that's used to treat child maltreatment is parenting programs that utilize in vivo coaching. So this is coaching where a therapist may be in the room with a parent and a child dyad, and providing in the moment commenting or coaching on the interaction that happens between the parent and the child. Sometimes that's done behind a mirror, a one-way mirror with a bug in the ear device, or it might be in the room, where the primary mechanism of treatment is the coaching that's happening constantly from a therapist or treatment provider, largely positive and emotionally supportive to the parent to help them to develop skills. It's often very skills focused, help them develop skills around providing warmth and nurturing and care and being responsive and attuned to a child, as well as some of the approaches will deal broadly with limit setting and even discipline and consequences when they need to be put in place with a child. These are typically treatment programs that are targeting younger children, and they're typically targeting parent-child dyads. So one parent in the room with one child in the room, and real direct coached action between the two of them.
Thank you. What about those that were probably efficacious? Sandra, over to you.
We found that relationship education, the largest number of studies that we identified in our search were relationship education, and they were identified as probably efficacious. They were programs that really taught people to do active listening, to ask questions, to, they practice as a couple, and the coach would be, or the relationship educator would be in the room with them, teaching them skills, and then they would go home and practice those skills and find that learning those skills and learning how to ask questions, how to be responsive, made a difference in reducing violence.
And what about those that were possibly efficacious? Sandra, you had one of those as well, I believe?
Yes, so cognitive behavioral therapy for couples was identified as possibly efficacious. And this is where also they're learning specific skills, a little bit different, but it's a focus on skills and improving their relationship. And that also was possibly efficacious. That was identified as possibly efficacious.
Glade, same question. What about possibly efficacious treatment approaches?
Yeah, there are a couple of those for the child maltreatment area. One is family therapy. Family therapy is sort of what you think it is, but family therapy approaches that were looked at in our study work with a wide range of ages from birth through 18, and may involve multiple caregivers in the room, may involve multiple children in the room. And the focus is largely on family relationships, including conflict, family communication, family dynamics. It's a broader treatment approach that sort of takes on more than a specific parenting or parenting education approach might take on. And then the other possibly efficacious approach in the area of child maltreatment is parent education programs. And this is kind of what you think it would be, but often these are parent groups, where a group of parents might come together with a facilitator covering a set of areas of content with the parents, where there's some group discussion around parents' experience. Some of the parent education approaches were provided in home with one parent only, but these approaches don't involve the child, and it's just the parent, and it's largely providing information to the parent on how to provide proper care to the child.
So what gaps in the research did you identify? And why is this very important for a future study, Glade?
Yeah, there are a number of things I think that we might draw from looking at all the sort of current and past research on child maltreatment. There's some early evidence that treatment approaches have a different effectiveness or different level of efficacy depending upon whether it was abuse or neglect. Yet studies really haven't looked at that specifically, which would have important implications for us as treatment providers. Similarly, there's some initial evidence that the seriousness of the maltreatment, or if there's been a re-report, repeated maltreatment, it seems there's a different responsiveness to treatment programs then as well. So it sort of begs the question, are particular treatment programs better suited for abuse versus neglect? Are they better suited for sort of more minor child abuse as opposed to more intense or more serious abuse? I think as we learn more about this, it'll allow us to offer more of a stepped treatment decision-making process, where we can look at specifically what is going on with the family and what would be most appropriate, the dosage and type of treatment that would be most appropriate for that family.
Thanks, Glade. Sandra, I'd like to have you answer the same question. What gaps in the research did you identify, and why is this important for future study?
Well, yeah, thank you so much. Well, I was invited to do this decade review in 2000 and in 2010 and then 2020. So I've really been involved in this work for a long time, and really disappointed that we're really not getting the research that we really need to look at how to treat couples when there's been intimate partner violence. It's situational violence. We know it's so common. We need federal funding. Federal funding tends to look at only batterers and victims, but they don't look at couples. And we find so many couples want to stay together. They want the relationship to work, but there's been some kind of psychological, physical violence, and we really need some more clear research that really addresses that. And I'm disappointed that we haven't really reached the next level as far as doing the research that we need to be doing. So thank you.
Thank you. Sandra, in 30 seconds, can you tell us what do the results of this research review mean for therapists?
Well, I think it means that we know that we're working with these couples, that we need to keep doing the training. We need to keep letting the community know what our role is with intimate partner violence.
Glade, same question over to you. What do the results of this research review mean for therapists?
Yeah, first I'd say that family therapists have a unique skill set, unique training to provide treatment that is needed for child maltreatment. And we know that there are multiple programs that have a significant impact on reducing the likelihood of a repeat child abuse and neglect, which has significant implications for our children.
Thanks so much. Thank you very much for taking part in our Decade in Review series and providing insightful commentary on the current state of research around using systemic interventions to reduce intimate partner violence or child maltreatment. Your work on this will be invaluable, continuing to advance the profession of marriage and family therapy. I want to thank all of our viewers for tuning in and joining us today. We hope you'll reach out with comments and any questions you may have. You can join in the conversation with us on Twitter by tagging @the AAMFT. That's @the AAMFT. Visit the link on the screen to read this article and more from our Decade in Review issue. Thanks so much for tuning in today.